And this session will be recorded. So if you would like to turn off your cameras, that's totally fine. And so, yeah, like I mentioned, I am the ambassador for Central Cal. My co-lead is not here right now. She did have class, but at CD helped me plan this event for you all today. Next slide, please. So briefly, we want to mention some facts about Mi Mentor. I don't know if this is y'all's first event or if you've been to a Together We Mentor before, but really the mission for Mi Mentor is to develop and support innovate mentorship opportunities. We want to, inspire the next generation of leaders, healthcare leaders from underserved communities. So, we envision a world where we're all aspiring, health care providers have the right mentorship to reach their goal. Next slide, please. So really briefly, this is our Alliance and Mentorship Board. So these are all physicians who help support Mi Mentor and us as the student leaders. They provide us with connections to different mentors. They provide us with connections to speakers that will come in and provide information to all of the students we hope to serve. Next slide, please. So like I said, Mi Mentor has different events. You are attending one right now. Together We Mentor. We also have Together We Leads. We also have MSR, which is a great resource for those applying to medical school. These are all things you could look into via our website at www.mimentor.org, or please feel free to scan this QR code so that you may download the app. It's a free app and it's full of great resources. And through Mi Mentor, becoming part of the board, you can, gain so many leadership opportunities. So I highly recommend making a profile. Next slide, please. Okay, we'll go ahead and get started with our first speaker, Soham Mhatre. Thank you so much for being here.
Of course, thank you. So a little bit about me. My name is Soham. I graduated from UC Santa Barbara in 2019, and I'm currently living at home in San Diego. So I first heard about CaHPSA during my second year at a Bio Mentors study group session. It was my mentor at the time. She asked me if I wanted to kickstart some new club, right? I was interested, and I'd never heard of CaHPSA or knew anything about healthcare policy at the time. So I was very new to the scene. It's safe to say I had no idea what I was getting myself into, but I am very thankful that I chose to dive headfirst into it. So a little bit about CaHPSA. CaHPSA is a student-run organization that focuses heavily on healthcare advocacy and education. Our 4 core pillars are education, advocacy, mentorship, and empowerment. And each of the 16 chapters that we have across California will embody each of these characteristics, but they may choose to focus on some more than others. On the top right picture, you'll see a map of all of the different undergraduate and medical schools, and I believe we have one community college as well that takes part in this CaHPSA organization. So of these 4 pillars, right, I want to discuss them a little bit more. So education, I think that's an obvious one, right? Our healthcare system is filled with so much jargon that it can be pretty difficult to kind of, understand it if you're new to it and you knew nothing about it, right? So we try our best to introduce people into healthcare legislation and policy and try to get them more knowledgeable about the topic and hopefully spark some interest. So that's something that we do. For advocacy, CaHPSA gives its members tools to become advocates, right? So many of our chapters will host different events that are focused around talking with local state representatives or practicing advocacy for a better healthcare system, right? So one of the events that we threw at Santa Barbara was where we talked about the universal healthcare legislation, AB4 and SB29. That would be the picture in the bottom left that you'd see there. So this little billboard that we made, it was a group effort with my team and we just sat in the most busy part of campus, and whoever came by, we just, got their 5 seconds to talk about it. So it was very fun, and that's something that CaHPSA does a lot. We try to advocate for our partners and coalition members is bills that we all support and favor. Going on to the next part, right? Mentorship. CaHPSA has an older sibling, called CAPA, or the California Physician Alliance, right? Both of these organizations work hand in hand because they have the same goals, and most of CAPA is made up of physicians who are very involved in advocacy and are very interested in furthering our healthcare system. So this is a great resource for us students to kind of see, to communicate and also get in touch with some of these mentors. And they are pretty often, they host like little meetings or informationals kind of like this. So lastly, empowerment, right? The last of the 4 tenets. This kind of goes hand in hand with advocacy, I'd say. So CaHPSA teaches its members to let their voices be heard and make a presence on their campus and try to incite change to some degree, right? So the poster that we did kind of works along those lines. So starting up at the Santa Barbara chapter, right? I was the secretary when I first started. And when you're the secretary, you have to deal with a lot of the administrative duties that clubs need to perform in order to get up and running, right? So some of these may include like booking rooms, right? You have to book them well in advance so that you can have the room for your general meetings or even for board meetings. Also, you would need to, you would need to go to training events that your school hosts that are mandatory, and also make sure that your club is officially recognized. These things are all very important because if your club isn't officially recognized, you kind of lose out on some of the free resources that your school can provide. So that's like free resources would include like access to their lecture halls or projectors and printing services, right? All of which are very important for running a club and trying to make your club out there and well heard, right? And I know different schools do it slightly differently, but it'll probably be in your best interest if you're looking to start up a new chapter to take advantage of what your school provides. So I started off at Santa Barbara. I was the secretary, but then eventually during my senior year, I worked my way up to president. And so I have a fair amount of experience kind of dealing with starting up a new chapter and all the kind of like not talked about stuff that goes in behind it, right? So if I were to give everyone one bit of advice for what I think makes the best and most successful clubs, that would be to have a very passionate and motivated board, right? These are the people that you're going to be working with very closely. And if these people are your friends and they have the same interests and like same drive as you, your club will always be successful. You can't start a club up on your own. It is 100% a team effort. And that's something that I would dedicate the Santa Barbara CaHPSA success to. We had a really good team behind us. And lastly, before I wrap up, I wanted to talk about one more thing. So before I graduated and left Santa Barbara, I started working on a side project for CaHPSA, right? That would be the CaHPSA e-newsletter. So during my final year at Santa Barbara, I kind of realized that I learned a lot about healthcare policy, right? Just kind of passively being a part of CaHPSA and kind of being involved here and there, I gained a lot of background information that I didn't have my first year starting in, right? And that background information really helped me like understand a lot of like policy and articles and other newsletters about healthcare. So one of the reasons why I wanted to start the CaHPSA newsletter was that I wanted to develop a very simple resource for people who know nothing about healthcare or don't have that background information, and give them access to start learning, have them be able to read something very easily, very non-intimidating, very simple, right? But get a good understanding of what some hot topics in healthcare currently are. That's kind of what we try to do at the newsletter. Our articles, we summarize hot topics, and we also provide our resources, our readers resources to go learn more about the topic if they are interested. Currently, we have almost 2,000 subscribers. And if you want to subscribe to the newsletter, there's a link in this presentation called CaHPSA e-newsletter right there at the bottom. And that'll take you to a list of all of our newsletters that we currently have, and also a sign up list. The newsletter is free, by the way. It's completely free. It's produced by students. So yeah, that's something I would recommend you guys check out if you would like to. But that's all I have for you guys. I guess the next speaker would be Angelica. So I'll let you take over.
Great. Hi, everyone. My name is Angelica Martin. I am currently a second-year medical student at UC Davis. My history with CaHPSA actually at CAPA goes back a long time. I actually was the CaHPSA coordinator. So I was in charge of all of the CaHPSA groups, CaHPSA chapters throughout the state of California. And then I became associate director of the California Physicians Alliance. That is an actual nonprofit working with legislators and everyone else, all of our other nonprofits and partners to pass laws and bills that would improve healthcare for everyone. So in the pictures that I chose for this slide, actually, this was my first lobby day with CaHPSA. And those are all students that we gathered that were college students who were advocating for SB4, which actually passed. And the students were a part of getting undocumented children access to medi-cal. I mean, how amazing is that? Just by showing up and saying, hey, we are the future of healthcare. We care about this. We want all of you legislators to vote yes on this bill and give undocumented children access to medi-cal. This was in 2014, 2015, when this work was going on. And ever since then, children in California have had access to medi-cal, and these students can say that they were there when this happened. The picture on the right, you'll see a student in a white coat. His name is Keon Mitchell. He was actually a part of CaHPSA when he was in college. He did an internship with CAPA, the parent organization, and then he worked with CAPA for that internship, and then he went on to medical school at UC Davis. And he's currently a resident at UC Davis as well. But it just goes to show you that students who are passionate about this, who care, naturally are drawn to this. And CaHPSA is a way to give students skills to do something. And a lot of students don't realize that by sitting in front of a legislator's office, being a warm butt in that seat and saying, my name is Angelica. I am a child of immigrants and I care about this community. They deserve to have access to healthcare. Everyone deserves access to healthcare. And I would like you to vote yes for this bill. It's so powerful. And then you tie in, and I am a pre-med student, or I am a medical student, or I'm a public health student, or a nursing student, or whatever. But you say, I am, this individual, this is my background, this is why I care. And they're like, oh man, these are the people who are going to be voting for me. These are the people I'm supposed to be representing, and I need to listen. And it's just so powerful. So these are some of my favorite pictures that just show the power of CaHPSA and some of the work that we've done. That's honestly one of my proudest moments, to have played a small part in that. But I think I want to take a step back and just really talk about my experience with CaHPSA and health policy in general, and how I got involved, because I know that a lot of people are intimidated by this field. And to give you a bit of background, I grew up in a single parent home. My dad died when I was 3 years old. And so it was just my siblings, so older sister, younger brother, and my mom throughout our whole lives. We relied on every social service. So food stamps, medi-cal, I love medi-cal, and Section 8 for housing, anything and everything you can think of. So when we talk about, these like underserved communities, I am part of that underserved community. Like, I still identify as that. So I grew up in that environment, and I think that really shaped how I viewed the world, that everyone deserves access to opportunity and to dignity, to be treated with dignity. And when I found public health accidentally, I'm like, oh my God, this is what's been missing in medical care. Why aren't people talking about this? So I thought I was going to be designing, nutrition programs and community health programs and all of these like health fairs and stuff. But like I said, I grew up in a single parent home, so we didn't have any money, not even a little money, just like any money. And when it came time to do my internship for my MPH, I was looking around. I had something set up that was unpaid at the Department of Public Health. And then my friend who was working at a politician's office, she was like, hey, Angelica, we have a position open. And I'm like, why am I going into politics? Like, that makes no sense. Health has nothing to do with politics. And I regret ever saying those words because obviously that is not true. So she kept, being like, no, you should really apply. I'm like, no, it doesn't, that I don't want to get involved in politics. And then she's like, oh, it's paid. And I'm like, I'm there. I need to pay my rent. And she's like, oh, it'll be, you'll be working with like the Department of Public Health. I'm like, perfect. So, that just tells you the reality that someone from my background has to take into account, right? Like, I need to pay my bills. I need to somehow survive. And I was lucky enough that that allowed me to realize, hold up, there's people who are making decisions about the programs that my family relied upon to survive. There's people who are making decisions about which clinic gets this amount of money, or even right now, which clinic gets this amount of vaccines. And that's all politics. And people like, I didn't realize that at all. So that's why when I was like, oh, politics has nothing to do with it, I'm like, oh, Angelica, stop. So that's my story of how I came into politics in general. And then I actually worked with a politician for a bit, and due to term limits, I had to find another job. And I was lucky that I had been in contact with nonprofits, and that's how I came across CaHPSA. They had an open position, and it was a perfect fit. So I share this story because it just tells you that, number one, people from a background like myself, very poor, low socioeconomic status and all of that, that it's important for us to use our voice when we are in a position of, hey, let me wear my white coat, and all of a sudden people listen. And no one talks about that. And then also, number two, that even someone from, Echo Park, which is where I'm from, and just a student right now, just like I said, sitting in front of a legislator and telling them, hey, it's important that you vote for this, and this is why, and sharing your story and being a part of a larger group. There's strength in numbers, and that is very true. You can make a difference. You can help little kids have access to medi-cal, and possibly have them live a healthier, happier life. So that's, I think, what CaHPSA really embodies, the fact that it's young people who have a lot of ideas to offer. We haven't been as tainted by all of the negativity that goes into politics and everything like that. So I think it's always great to work with students in that sense. So I just wanted to share that. And then also, of course, that if you are in medical school, you're thinking about going to medical school, that it's, like Keon here in that picture, he took time out of his schedule to go and speak. And it's so powerful to have a group of students, especially students of color, in their white coat, standing in front of the Capitol saying, hey, you need to vote for this. And this is what I'm seeing with my patients. And this is why I went into medicine in the first place. So I just want to really make that point, and a case to, because all of you will probably get to some sort of health professional setting, and it's important to remember that and to utilize that for the greater good. So yeah, I think I just wanted to share my personal trajectory into finding out about politics, realizing that politics matter, even if it is embarrassing, the fact that I didn't think that they mattered at all. And also into how I use that to make a difference, and we're young, and I'm actually really short. I'm only 5'2". So when you look at me, you're just like, oh, okay. But it's nice to know that by joining with other people, joining with other organizations, and, really caring about something that a little 5'2" Latina daughter of immigrants has made a difference, and all of you can too. And I just want to be encouraging, if any of you are thinking about starting a CaHPSA chapter. There was some great advice given beforehand, and it really, the smallest acts such as showing up for the legislative day can make a big difference. And you can call that your CaHPSA chapter. That can be your one big event of the year. There's so many ways to go about doing it. And last thing I'll say is there's certain obstacles that are put into place to keep people out of certain spheres. So for example, with politics, you're talking about all the jargon that is used. I find that completely unnecessary. And so one of my main objectives when I was with CaHPSA was, no, we are going to make this as simple as possible. If you can't explain this to a person in middle school, then you are speaking it's too difficult to understand. You have to really just tone it down, because using big words and all that, that's not helping anyone. So I think that applies to a lot of things. If you're going into the healthcare field, you will notice that you have to take all of the textbook information and clarify it as much as possible for your patients. If you are a covered California, counselor, you have to take all of that information, the application and everything, and make it as simple as possible for that person, or else you're not helping anyone. You're actually making it more difficult for everyone else. So I encourage everyone to, in the spirit of CaHPSA, if you start a chapter, to just boil it down, very simple terms. And then number two, in the future, as you move forward in your health professional journeys, to always remember that, and to really check yourself a lot. I try to do that so often. Check yourself and make sure that you are really being as clear as possible, using simple terms, so that there's no miscommunication, and so that you can make a big difference as well. So let me know if you have any questions, and I think I will turn it over to the next speaker.
Thank you so much, Angelica. Hello, everyone. I don't know if I can top off the presentations by my two previous speakers. They're amazing. My name is Yesenia Buenrostro Ramirez, and I actually just as of recent, like a year and a half maybe, started to become very involved with CaHPSA. I'm from the Central Valley, born and raised in Fresno, so I know that this organization was more so based in the SoCal region. And so, which I think is amazing, we need to start somewhere, but, coming from an area where it's also very underserved, and we do not have many resources, especially, for motivated students that I have had the honor of working with, and some of my my dear friends are here, hoping to get information and hopefully start a chapter here in Fresno. So, I became very involved. I started attending meetings. I started, collaborating with with Farouz, who was the CaHPSA coordinator before me. And so, really trying to see what we can do here and what we can get started to motivate and move, these students who want to be healthcare professionals. They need to understand that you can do so much, in your office, right? Serving with that white coat on and providing healthcare, but you also need to, I think, take a step back and realize, are we doing as much as we can? And I think that that's where, the politics come into play. You need to make sure that you have the right people on your side to make the best choices and decisions for your people, for the communities you want to serve. So a little bit about me. I did complete the certification to be a certified enroller. So that's my little badge up at the top right. I was super excited when that came in. I was like, oh my gosh, I can help people enroll in healthcare. But it was a bit of a lengthy process. It was like, I think, an 8-hour training. You have to really commit, and you want to be really well informed, right? You don't want to just kind of treat it like whatever, because then when it comes to it and you have to help somebody, you're like, oh shoot, I don't know what the answer is. So it helps to really stay committed to the training, really become very well aware of everything that you're learning, because you will essentially be helping, sometimes even just Spanish speakers who can't figure out how to fill out this application. And so it feels, I think, rewarding, right, to be able to give that support. And so that's a little bit about Project White Coats. And for the Medicare celebration, I was actually also able to, if you see me and Soham down here, working together to create, the event, Celebrate Medicare, because we obviously do support, as CaHPSA Kappa, expanded healthcare to all. The end mission, then goal is to have healthcare for all, no matter of status, no matter of race, nothing should matter, because we do believe, I truly believe that it's a natural born given right, to receive healthcare, to, be given the resources to be healthy and individuals. So I did create this little graphic on the bottom left, for the event. And that was one way that I started getting involved, right? It's like, whatever you need me to do, I can do. If all I can do for now is create graphics, is help the day of the event, or whatever it is, like I want to make sure that I'm putting my time and effort into something that matters, something that I'm very passionate about. And so I'm very excited that, I had that opportunity. And I guess some news. So I just recently was appointed the CaHPSA coordinator, along with my co-coordinator, Leah. So we're very excited. I might have to speak with Angelica to give me some guidance on how to do this position. It's a little stressful so far. I'm just trying to, get situated, but I'm very much excited. I will be working with the Southern California chapters. Sorry, that was a mistake. And the Central Valley. So we really, again, hope to expand and start some chapters here in Fresno, hopefully Bakersfield, Merced, just to create, because it's a statewide organization, right? I don't know if y'all are aware. So we want to, expand. And I think that, me being from the Central Valley really will help with those efforts. And I know, again, motivated students, we have them here. We just need to make them aware of these opportunities, right? And again, though, as Angelica mentioned, like, it's a passion, it's a calling, you have to really, we all want to pursue a career in health. We all want to, maybe be nurses, doctors, PAs, but it's like, take a step back and really reflect. Am I also wanting to do more outside of that office, outside of my white coat, and that's really where CaHPSA comes in. It's a passion. It's just, because it's a lot. It's a lot to sit there and read through bills, understand them, right? And then also having to, like Soham does, like, take that information and compile it into a document where it's easy for the general public to read, right? So it's just a lot of that. It's just, I'm very excited. I think I'm a loss for words for, the start of this journey for me, and what I will hopefully motivate more students around here to do. Next slide, please. Okay, so I also want to touch base on certain events that I was able to attend that were amazing. So the first one was an advocacy tutorial session, which was led by two CaHPSA leaders, and they just, like, wowed me, right? They sat there with us, some undergrads, there might have been some current grads, but really they were trying to guide us and provide us with the main points of how to properly advocate, right, for our communities and for what we want to stand for, and the change we want. So it was a very interesting session. I believe Melanie, we met right at the session, and then later on in our path, we met through a Mi Mentor event. The Together We Lead Women in Medicine. She attended that event, and I remembered her name and I remembered her face, and I direct messaged her, and I was like, oh my gosh, hi! Like, I went to your session. You talked about advocacy, and I think you're amazing. And so then we connected there, and then it's building that network, and it's standing with people that believe in what you believe in, and it just supporting each other. So I thought it was a great experience. And over here to the right, I took a screenshot of healthcare disparities in healthcare by Dr. I'm so sorry, Dr. Latanya. Yes. She was an amazing speaker. Oh my goodness. Another, great night of learning. I think that once you join in on CaHPSA, you just, it's continuous learning. It's becoming aware of the new trends, of the new important, just as Soham mentioned, important things that are coming up in regards to medicine and healthcare and things as such. So I think that that's one of the best things that CaHPSA can also offer, is that environment to be informed. So yeah, that's a little bit about those events. And I believe that closes my little spiel. And I think we can actually go ahead and move on to questions. I know hopefully many of you, if you joined us in a little late, were able to see on the chat, you could direct message Liz or Harleen with some questions, and we can get started with those. Liz or Eileen?
We haven't received any questions, so just drop them on the chat. Don't worry about who you send them to. We'll just read them through. But we were just
Can I-
talking with the leaders that we did not. I mean, I'm a rising medical student this fall, and I wish I would have known about CaHPSA a long time ago.
Can I add a little bit more about CAHPSA?
Yeah, go ahead.
So the California Physicians Alliance is what's considered a parent organization of CaHPSA. So CAHPSA is recognized by the state of California as a 501c3 nonprofit. It's most, like Soham said, it's composed mostly of physicians and other individuals who support a universal healthcare system, specifically through a single payer model. And that just means that everyone would pay out of their check and into one big pot, and we would all get health insurance, kind of like Canada. There's other models that are of healthcare as single payer as well throughout the world. And there's other events that you can attend to learn about those other features that could be added or excluded from whatever the United States single payer system might look like. But I say that because it just goes to show that CaHPSA, yes, it's a student group, and it's a group that's on college campuses or medical school campuses, but it has some meat to it, right? It's related to a nonprofit organization that has individuals who are out there working day in and day out to talk to legislators, to work with other nonprofits that are meeting with, everyone under the sun to try and get these laws in place that then affect our lives. So it's more than just a student group. It's literally, you are actively working on creating a better healthcare system. So that's what makes CaHPSA a little bit different than other student organizations. Also, if you're interested in, if you're pre-med, it's a great way to network. You meet these physicians who are very nice and very passionate. Obviously, these individuals self-selected to be part of this organization. So it takes a certain personality and type of person to be involved in this. So if you meet them, at a little social that they're having or whatever, you can reach out to them and be like, hey, can I come shadow you once COVID is like over or whatever it is. So that's another way to network. If you're a medical student, I know that from personal experience, that time is very short, and you're basically being pulled in multiple directions. And also for college students around like exam time and everything like that. I just want to emphasize that you don't have to be like all in to be in CaHPSA. If you show up just for one event, congratulations, you are a CaHPSA member. I mean, unless your bylaws say that you have to attend, 3 meetings or whatever it is. But my whole point is that, like the picture that I showed of Keon at the Capitol, that was just one event, but it was so powerful. And that's when it matters that you show up, right? Because it's like, we can show up as Kappa staff, we can show up and say, oh yeah, we have 7,000 members. But if it's just 2 of us, they're like, yeah, sure. But if we show up with 400 people and we're like, no, we're 700 and here's 400 of us who care and, want to show you, that speaks a lot. So if you show up for one meeting, if you show up for one movie screening, I know that CaHPSA has a couple movies that they like to show. So you can do that. If you hold 2 to 3 events, guess what? That's 2 or 3 times that someone learned something new about universal healthcare, about the fact that undocumented children got access to medi-cal only in 2016. I mean, that's only 4 or 5 years ago. The fact that before the Affordable Care Act, if you didn't have a child, you weren't allowed to get medi-cal, even if you were dirt poor. Like that doesn't register to us who are younger, who have always just had this available to us. So it's easy to take it for granted, and it's easy to not be outraged when it's taken away from us. So that's my little spiel for, you don't have to be all in and be a nerd about health policy and be reading all these journals. You can literally just be like, oh yeah, I know Medicare is for elderly people 65 and over, and I know medi-cal is for people under the federal poverty level, and you already made a difference. So you can be as involved or as little involved as possible.
Thank you. I have a question. Well, received the question on like, are there any steps as to like how to become more involved with CaHPSA? Like, do you email someone? How do you start getting involved?
So I just want to add one thing before we get into this question. The CaHPSA coordinator, right? So now currently Yesenia, but also Angelica. Angelica was the CaHPSA coordinator when I was starting up the Santa Barbara chapter. I don't remember if she remembers that, but she was also very helpful to us
Yes, because of
starting that chapter
Bill.
up.
Yes.
It was, yes. So the CaHPSA coordinator, if you're interested in starting up a new chapter, is going to be very key. You know, they will be your link to all of CaHPSA. So they'll give you the guidance and also like help you kind of get connected with people and other maybe CAPA members who are in your area. So a very good resource to use if you are interested in not only getting involved in CaHPSA, but also starting a chapter.
I could add to that. So thank you so much. So yeah, if you want to reach out to me, I will drop my email in the chat. But yeah, so I will be handling the Central Valley and the SoCal chapters, you know, in this region. But I do obviously have connection with my Northern Cal CaHPSA coordinator, who I can put you in direct contact with via email. So please feel free to reach out to me.
The strength of CaHPSA, like I said, is the fact that it's connected to CAPA, which is filled with physicians and other health professionals. So in terms of starting up a chapter, you want to find, if you're in college and your bylaws say that you need 5 people, a treasurer, a vice president, a president, and whatever other positions they say is the minimum to have, just reach out to maybe your AMSA club and be like, hey, I want to start this other club if you guys want to be involved in that as well, or any other your friends, just like, hey, do this with me. And just make sure you have those individuals set, and then you can reach out to the CaHPSA coordinator. And the beauty of it is that you need a speaker, and they have a list of people who can be a speaker, especially right now with Zoom being the mode of everything. It's so easy to be like, hey, I know I'm in LA, but we really want to talk to someone that looks at healthcare through like climate change. There's a bunch of people at UCSF that would love to talk to you. They would get on a Zoom call, and CAPA can, just make a phone call for you. So they can help you with that. And then also, there's a way to, I always encourage the CaHPSA chapters to create like a calendar of events that you think you might want to have throughout the year. So maybe one month you have a movie screening, then the next month you have a speaker, then the next month you have like a social night, whatever it is, so that when you get busy with finals and exams and papers and all that, it's kind of like on auto drive. And they can help you figure out what type of events people usually like, what type of movies you usually watch. There's a couple of them and stuff like that. And I saw that there's a question, is CaHPSA only limited for college students? So actually, no, we've had a lot of recent college graduates get involved. And actually a lot of them have become either done like an internship through us over the summer, or become the CaHPSA coordinator, or stuff like that. I don't know if Soham or Yesenia, you guys want to speak to that?
Yeah, I mean, like, it's not limited to just undergrad or even just med school or anything like that, right? Honestly, especially at the chapter in Santa Barbara, we advertised it for everybody, not just pre-meds. We advertised it for pre-law, anyone interested in healthcare, anyone who wants to like learn about advocacy even, right? So it's open to everybody. And if, let's say you're in the SoCal area and you wanted to get involved in CaHPSA, I would probably suggest, like, let's say you're a grad, right? You graduated undergrad, you're not into college right now. I would suggest you reach out to the local CaHPSA chapter, the one nearest to you. They might have some events that you can join in on. And I think most of the events nowadays are through Zoom. So you could reach out to any of them. And I'm sure they're more than happy to have an extra member.
One of the questions is, how has volunteering with CaHPSA been affected with COVID? Are there any virtual opportunities to be involved with CaHPSA?
Yeah, I can go ahead and take that one. Only because when I got certified as an enroller, COVID was like, starting to pop up. So it was hard because I know that Project White Coat usually does or did events in person where they host, they usually, I think, from what I was told, partner with an organization and then promote that, they will be enrolling individuals into healthcare. So I wasn't able to ever do an event like that yet because of COVID, but I was able to shadow and complete a call over the phone. So Feroz was able to connect us with an individual who had general questions about registering for healthcare and how to, how to do it through Covered California and things as such. So, there definitely was still an opportunity to provide assistance and volunteer even during COVID times, definitely. And like I said, I don't know if you had logged in yet, but I did mention being able to help with creating graphics and supporting the Medicare event that happened last summer. So I don't know if you can also touch base on that. I know you also volunteered for that.
Sure. I mean, yeah, the Medicare event, whenever CaHPSA has like a event that's like, typically they're kind of broken up into NorCal and SoCal, but because of COVID and how everything has become virtual, it's kind of just been like for anybody. You can always get involved in those things whenever they happen, right? Like the Medicare event was a good example of that. The newsletter is another example of that, where we have people from like some of these people who are on our team, like weren't in a CaHPSA chapter in the undergraduate career, right? So they kind of got into it, they thought it was interested, and then they wanted to help out. So that also the Instagram, right? We have a statewide CaHPSA Instagram. If you're interested in, like Yesenia said, creating graphics, or maybe you want to, I don't know, like help with the social media presence of CaHPSA, that's definitely something that you can get in touch. I think Yesenia, you could they get in touch with you for that?
You can definitely get in touch with me, and then I can figure out direct them in the right direction for sure.
Definitely. So there's many ways to kind of get involved, and with everything being virtual now, that's definitely a lot easier than having to drive to different places.
The next question in the chat says, what does the process of starting a local chapter look like?
I can take this one. So Angelica mentioned that the first thing you'd want to do is gather a group of like 4 or 5 people, however many your school would require to start up a club, right? So once you have that, you would want to try to assign roles. And so everyone is kind of like can acknowledge what they're meant to do and what part they play in this new club that you guys are starting up, right? And then I would also think it'd be helpful to decide what you want to focus on in CaHPSA, right? Like I know some of our chapters are just PWC focused, right? They just worry about Project White Coat, whereas other ones are more like advocacy or like education, right? So there's a wide variety of things that you can be like, do as a CaHPSA chapter. So get a group, right? First thing would probably be to get a group. Then I would probably contact the CaHPSA coordinator in your area and try to see if, just kind of let them know that you want to start a chapter and that you are in the process of doing so, right? That way they can send you resources, kind of help you get more like knowledgeable about what CaHPSA is, what CAPA is, stuff like that. And then try to go through your school to become an official club, right? So there's a lot of like, each school has their own portal, and through that portal, you would have to sign up, register as a club. You have to like submit a constitution, which basically just says like who all the members are, what their responsibilities are, and what your club is meant to do. And then once that's set, there's like, they'll guide you through the other steps, right? Once you submit that, you get recognized, you'll become an official club, and then they'll guide you. They'll be like, oh, like, hey, all official clubs need to undergo this training, or, I don't think there are any like requirements for like how many events you need to throw or anything like that. Not that I'm aware of, and not at UCSB, but like whatever those requirements are, you just want to hit them. If you need an advisor, I would suggest going to maybe like one of your professors and asking them like, hey, I want to start up this new club. Like, can you be an advisor for us? And most of the time, they'll be a little like curious, like what's the club about, stuff like that. You explain it to them, and I think they'll be pretty like on board for the most part if they also deal with this healthcare advocacy or healthcare in general, right? Like at SB, we used our pre-med advisor. We asked him to be our advisor for that, and he was very happy to be on board with it. So it was not that difficult to get him involved.
And if I could add to that, I wasn't able to start a chapter here, unfortunately. So I really hope that, somebody here at Fresno State, it takes that initiative. But from what I've seen in my short time as coordinator and meeting with the different leaders, presidents, co-presidents of certain chapters, I know that, we provide you with the tools of this is what we support, this is why. But really what I've noticed is that many of the chapters, especially in like the UCLA, the UC Berkeley, they take that initiative and they run with it. I just met with one of the co-presidents for UC Berkeley today, and he was explaining to me how they want to do a week full of like advocacy and things as such. So, they plan to host like with either a webinar or some type of short event per day. Right. And then on the 6th day, they hope to hold a conference. So, and this is all student run, and it totally motivated me and made me realize this is why I'm doing this, because I want to work with individuals who are so passionate, right, of with the same ideas that I stand with. So definitely it's kind of, we do give you some guidance, but it's also what you make of it and what you want to have your body of students do, right, at your campus and your designated chapter.
So one thing to keep in mind is the timeline of your school to be recognized as a chapter. So at the med school for Davis, we know that we have to submit paperwork by, I think, around April to be recognized as a chapter, by UC Davis Med School. And then the undergrad, I think the paperwork is in June. So if you want to start a chapter, just make sure you get all the people together and your position sorted out before June, so that when it comes time to submit the paperwork, you don't miss the deadline and all that stuff. So that's number one. Something that we found that was a little difficult if students didn't know the deadline for that. And you can find out the deadline by contacting your school's student group office. Each one has like a different name. I do want to point that I remember at UC San Diego that they did have a minimum amount of events that the students had to put on. I think it was one per quarter or something like that. So it wasn't too bad. And the beauty about CaHPSA is that, like Yesenia and Soham have said, it's literally, you can do whatever it is that you want to do. If you want to just hold movies and talk about that, because that's all the bandwidth that you have for it, that's fine. If you want to hold a talking session with a poster board and have people, well, when you have people put up, like sticky notes and stuff about what healthcare means to them, you can do that. So you can make it as big or as little as you want. It's all up to you. And then it's, I think it's also important to remember that you have the support of CaHPSA as the institution. So there's ideas there from past years, right? What did other chapters do in the past years? Maybe we can do that at UC San Diego or at UC Berkeley or at, Santa Barbara, because we haven't done that locally. So it's kind of like you can literally pick and choose, like, okay, that activity sounds good, that one sounds good, and we'll do it in September, and then we'll do the other one in January, and we're done. So it's not like you're starting from scratch, and that's really, really, really nice. You have a template. Speaking about templates, there should also be a template for a constitution that you can turn into the UCs. We used to share that with students as well. And it's just, talking about what CaHPSA is, and you can input whatever else your school needs for that and change it as necessary. But once again, a template is there. So that's one of the benefits of being involved with CaHPSA and CAPA, that there's precedent set and you're not starting from scratch. You're actually just replicating something and changing it a little bit to meet your own needs.
Awesome, thank you. So one of the questions submitted during registration said, I'll just read it. It says, I love to hear about involvement, how teaching, educating on health policy reform looks like right now. Is it like classroom based? Is it hands-on? working directly with the communities. Can you speak more on that?
And I submitted that question actually. My name's Isabella. I joined a little late. I do have a question in regards to being a non-traditional applicant. My hope is to apply to medical school somewhere in the near future, but I am 26 now. I've been out of college now for a while. And so I'm wondering along those lines, what are the opportunities in terms of, say a non-traditional applicant that wants to get involved in health policy and reform, especially in the community, if you have any of those opportunities?
I first want to start off by saying that I am 30 and I applied to medical school twice, and I am not ashamed to say that. I got on the wait list the first time, didn't get in, and then I applied the second time. So I got into medical school when I was turning 29. So not a big deal. If anything, honestly, it makes you a better applicant because you actually know what you want to do and you're more focused and et cetera, et cetera. You've actually lived, no offense to anyone that's younger, but trying to get something out of being a little older. So that's number one. Number two, in terms of being involved with CaHPSA, so what's happened traditionally with students in your position is a lot of the times they get trained to be certified enrollment counselors because usually you have a little bit more time. Maybe you're just doing a gap year, maybe you're just wanting to be more involved. So you can go ahead and do that. I don't know how Project White Coat is working right now, but basically it's an 8-hour training online, and then you would meet with people or maybe over the phone and help them sign up for health insurance. I think that also another way that, has been said already is to help with any educational materials. So if you live near a school, like a college, community college, whatever it is, and you have any contacts there, you can also, set up talks online through Zoom, invite a CAPA member to talk about what it means, how the Affordable Care Act changed healthcare. I don't think a lot of people realize the difference that made for those people like in the 20s and 20-year-olds. The fact that you would be kicked off of your parents' insurance once you turned 18, now you get a couple more extra years. So stuff like that. And then I'll go ahead and let Yesenia talk a little bit more about it.
Yeah, thank you, Angelica. Yeah, so please, Isabella, I'm sure you saw my email in the chat, but feel free to reach out to me. Probably the biggest thing would be registering you to be a part of Project White Coat. And depending on where you live, well, right now things are virtual, but we would definitely put you in contact with whatever chapter you're nearest to, and then you would be able to attend events with them. And also, if you want to be involved, I believe with the newsletter, you would be able to, help, decipher important information and put it in the verbiage that makes sense to the general public, which I'm not sure if you're a good writer, if you're, into reading and that's something that's one of your skills, you could definitely, be involved there. And really, yeah, getting the word out, informing people of the importance of universal healthcare, informing them about all the different changes and the importance of advocating for your community and their needs. So please feel free to reach out to me via email. We can, work together to see what best fits your schedule and what your strengths are.
Thank you. I appreciate both of you. I happen to be a high school teacher, so that would be pretty
Yes.
seniors. So if you guys, if there are representatives that would come and talk to my seniors, I would love that as well. Thank you.
So one thing for everyone here, I'm guessing most of you are planning to apply to a health professional school of some sort, medical school probably. All of these schools want to see leaders. And how do you show that you're a leader? You create something or you make something better. You look at something and you're like, this can be different or something is missing here. So that's what CaHPSA can be a vehicle for, to show, hey, look, I heard about this. I agree with the values. I hold these values. And then I thought about how I could bring that to my own community, or how I could integrate that into my own life, or how I can integrate that into, just something else that I really care about. And, I decided to merge them somehow. So an example off the top of my head, if you are part of a church group, right? There's a lot of people there who may or may not need health insurance. And maybe you decide to sign up to become a certified enrollment counselor, and you set up a health insurance information session for your church. That's great. And you're merging two of the things that you're already involved with. So that's an example. And like I said, for all of these, you have to start thinking about stuff like that, so that you can show these schools like, look, I bring something to the table. I am a leader. I am a self-starter. I'm able to be creative. And at the end of the day, all of these schools will want people that make them look good. So making a difference, you kill two birds with one stone, right? You're helping people and you're showing the school like, look, I will make you look good too.
Does anyone have any more questions? Feel free to unmute yourself, drop them on the chat. This is a conversation. Angelica, are you still able to like volunteer with CaHPSA while being a medical student, or is one thing on pause so you can do the other one?
No, so thank you for asking, because I was going to mention this. So I'm about to go into step studying actually at the end of this week. And this is actually part of my volunteering for CaHPSA, right? I'm volunteering my time to share about CaHPSA, to share my story about how I came to realize that politics has everything to do with healthcare. Because I know that if I would have heard that, I would have been like, oh wait, no, she has a point. So and I've seen that too. So this is part of like my volunteering, and I'm planning to do like another speaking engagement, and I'm always happy to do speaking engagements because I know the difference that it can make to have a Latina in medical school, just talk about these issues and everything. So on top of that, I care very deeply. I am very passionate about just dignity in healthcare and health equity, and just getting to a place that actually encompasses that. And I believe that healthcare, like I said, health policy is way too complicated and it's ridiculous. It should not be that way. So recently, I actually created a class at UC Davis for medical students. It's called First Aid for Health Policy. And it's just talking about health policy 101. So I basically took what I've been doing with CaHPSA. I was with CAHPA and CaHPSA for 5 years. So I took what I was doing with CaHPSA and CAHPA and made it for medical students specifically. So it was 8 lectures, and I invited people that were CAHPA. I had 3 speakers that were actually CAHPA members, who I knew could explain how a bill becomes a law very simply, or universal healthcare, single payer very simply. I invited them to come speak to the students for an hour, and that was my goal, and it still is my goal, to get more health professional students involved and to demystify health policy, because in the future they'll realize, oh, even how I get paid is affected by policy. Even how many minutes I spend with my patient is affected by policy. So if I can make that transition come faster, that'd be great. And then also, I've seen the power of a student in a white coat sitting in front of a legislator and being like, I want you to vote yes for this. So if I can get more of my classmates to do that, that would be great. And sometimes all anyone needs is like, no, that's overly complicated. What they mean is that it just has to go to one committee, which is a group of people, they vote yes or no, and then it goes to another one. And if you explain it that way, it's so much easier than, it has to have a majority and blah, blah, blah. And it's like, come on. So that's my way of taking the CaHPSA values and Kappa values, and continuing to use them. And my goal is to have this class in all of the UCs, all of the UC medical schools. So we'll see how that turns out. But it was a success at UC Davis. We had 48% of first year and second year medical students together, which was over 100 people per class. And it was very well received. So yeah, but
Awesome.
you can do that too. I just told you what I did. And when you guys are in medical school, you can like reach out to me and be like, hey, I want to do this at my school. How do I do this? And I'll be like, yeah, these are the steps, just like we're doing here about CaHPSA, right? Like, how do you start a chapter? Well, these are the steps. Here's the Constitution.
Thank you. Thank you.
Yeah, but it is definitely, there are weeks where it is very difficult to find time to do anything else. And that is okay, because there's always the next week and you can do something related to CaHPSA then. And like that was why I was making it a big deal. You can be as involved or as little involved as possible, but just know that, especially if you are in a health professional school, if you do even a little thing, it is worth so much. It has such a big impact. So just show up and wow, look at you. You deserve a pat on the back.
Awesome. Thank you so much. Does anyone have any other questions? Feel free to, again, unmute yourself, use the chat. Just wanted to mention there's a survey on the screen. It should take you about 2 to 3 minutes just to give us some feedback, to learn how much you guys appreciate this type of event, so we can do more of this. You can let us know. Maybe the speakers mention a topic that you would like us to recreate or something. So please take just a couple of minutes to let us know. And yeah, thank you to our speakers. Now kicking you out, just saying thank you. And for those of you, if you have more questions, feel free to like drop them on the chat again or unmute yourself.
I'm also happy to answer any other wider medical school questions, MPH questions, post-bac. I did the UC Davis post-bac as well. I'm old. So if you have any questions about that, working questions and all that stuff.
If there's any way we could get everyone's contact information to follow up with each of you, I'd really appreciate that.
And CAPA and CaHPSA both have web pages, and there's actually some videos on YouTube as well that explain what we mean when we say Medicare for all or single payer. They're 5 minutes each. There's 8 of them. Highly suggest you go on California CAPhysiciansalliance.org or CaHPSA.org to go look at those web pages. They might be a little out of date, but you can also just go get more information there.
We do have another question in the chat. So I think this one's specifically for you, Angelica. How was your process of post-bac and after college medical experience?
So I went straight from undergrad to graduate school. So I went to Wellesley for undergrad and I went to Boston University for my MPH immediately. And I graduated in 2014 from BU. And after that, I started working. So like I said, I was like, I need to pay my bills. I need to survive. So I went ahead and started working, and I tried studying for the MCAT. And I ended up applying, and it wasn't, successful. And then I really looked at my application, and I was very honest with myself. And I'm just like, you know what? It's your GPA, because my MCAT was okay. I took the MCAT 3 times, by the way. I'm so old that I took the old MCAT first, and then that one expired. So I was working for a while, and so I looked at the score that I had was okay. So it was my GPA, which was very scary to me because it meant that I was going to have to go back to school full time and was going to somehow have to support myself financially. And I think that that's also something that people don't talk about. It is me that I have no safety net from my parents, from my mom, like at all. It was very much like sink or swim. You're putting all your eggs into this basket. So I did the formal UC Davis post-bac program as a way to invest in myself and to really show like I'm in this, and to show them I had been out of school for 5 years already, out of undergrad for 5 years, and that's a long time. And they usually want to see some sort of schoolwork closer to that, not 5 years out of undergrad. Specifically, my MPH didn't count because it wasn't the basic sciences. So in the post-bac program, I only took the upper level division classes, and it was nice to be able to just focus on school. So part of the reason why my GPA was low was because, like many people, I was working throughout college and all these different things going on. During the post-bac, no, that was my investment in myself, and I was 100% just focused on that. I didn't do anything else other than study. And that was different because I'm so used to doing other activities and all these, extracurriculars and working and all these things, but we couldn't do that. We literally, our agreement had a sign saying that we wouldn't be involved with anything else. So obviously my grades were amazing during that year. So if you are doing a self-guided post-bac, I suggest that you try to minimize everything else outside of class. It really makes a huge difference. And you have to see the post-bac as an investment in yourself. It's literally money that you are putting on the table to say, hey, I know I can do this, and I just need to show them that I can do it. And my experience after college, I think that that's definitely affected by the fact that I had to take care of myself, find a way to pay the bills and all that stuff. And luckily with CaHPSA, when I was working as the CaHPSA coordinator, my boss at the time, he knew I wanted to go into medical school. I was very clear about it. And, he gave me advice, and we became really great friends. And it was a balance still between studying for the MCAT and also working. So when we would go on business trips, it was, to visit the other CaHPSA chapters or do a presentation at like the Davis conference or whatever, I had to find time to study. And that's very difficult when you're tired. And it's very difficult when you still have work to do. But once again, it's about being strict with yourself. And even now I'm still struggling with that, because STEP studying, right? Like STEP is a really scary exam. It's even scarier than the MCAT. And it's how do you tell your significant other, like, I really want to hang out with you. I've been so tired all week, but I know I have to study. And how do you, I have this agreement with my husband that I will talk to him from 5 to 6 p.m. every single night. And then after that, I have to get back to studying. Mind you, he just started medical school at MSU. So he's like in Michigan and I'm in California. So that's a whole another thing. But it's being strict. He has to be strict with himself. I have to be strict with myself as well. And I think that that's a theme that will play itself over and over again. I don't know if that answered your question or if you had any other specific questions to whoever submitted that. John. I want to say it was very scary for me. Like I am not used to basically, it felt like I was pushing myself to the limit. Like by that last week, those last 2 weeks of the post-bac program, I was running out of money. And I'm like, how am I going to do this? And, you have to plan for the future. If you're the position that I was in, you have to plan for the future. And I'm just like, I literally cut it down to the last dollar. And then thankfully my tax return came in. So I had like a little cushion, right? To get like another apartment and start working again. But still, it's being really realistic with yourself. If you have the ability to live somewhere for free with your parents while you study and all that stuff, but still get a like good studying done, do that. Just like, unfortunately, with getting to medical school, it is a lot of sacrifices, and it is a lot of putting yourself out there without a safety net and just jumping. But I think that I was told at one point that I shouldn't even think about, I asked about scholarships, like maybe what type of scholarship I should be looking at to apply as well while I was applying to medical school. And the person I was talking to said, with your grades and your application, you shouldn't even be thinking about scholarships. You probably won't even get into medical school. And I was just like, okay, I thought I was supposed to be getting advice from you. Like, what? And it's just like, well, you can take or leave any of the advice that you get. And I decided to leave that advice, and I ended up getting into medical school. So it worked out. How was I able to afford the program, and how were the loan situation? Congratulations on getting accepted to an MPH. So one thing that a lot of people don't know about, it's tuition remission. You can work at the school, and they will, depending on what school it is, sometimes they give you 50% off, sometimes they give you 25% off, etc. What you can also do, some of the people that I went with, they went part-time, so they still worked, and then half of the time they went to school, and it'll take you longer, but at the end of the day, you will pay less for it. I was actually very lucky in that I'm a Gates Millennium Scholar, so I had a scholarship for my MPH, but that didn't cover my living situation, right? So it only covers your tuition. So for my living situation, I, number one, lived with roommates. Number two, I worked at Club Monaco selling clothes, overpriced clothes. And then I ended up actually switching over and did research at the school. So if you can, I'm guessing you're starting in the fall, I would start reaching out to any of the professors that you think you might like their work, and see if they're looking for a research assistant. And honestly, send out a bunch of emails, because I can't tell you how many people like never even replied to me. And that's fine, because they're all busy and they trust me. They probably have 2,000 emails in their inbox that they have to get through. Whatever. Don't be discouraged. That's the whole point. But try to get a research position, research assistant. They pay really well. I mean, for, a student, it's like $20, and I was doing interviews. I speak Spanish, so I was doing Spanish interviews. I needed someone. So, you can do that. Look at tuition remission if your school offers it. Also, always send an email to the financial aid office and be like, hi, I'm super excited to be starting. Are there any scholarships or grants that I can apply to? I really want to attend your school, but I am worried about the cost of attendance. Sometimes they'll give you a little extra money. Sometimes they won't. It just depends. If you are staying in the state of California, I suggest you, because you will need health insurance. And if you don't have your parents' health insurance, or, a partner who is working and are on their health insurance, I highly suggest you apply for medi-cal. And, you are entitled to have medi-cal during your graduate school. So you can go ahead and save some money on that, because I think our health insurance is like almost $3,000 here a year, $2,000 or $3,000, and that adds up. So I would say that, do that.
I want to go ahead and answer Charles's question. I believe he's asking about Project Whitecoat. Yeah, Charles. So we definitely are still able to help enroll individuals. So the process is you have to submit, which you can find it on the CaHPSA website. It's a form, it's a Google form. Submit certain information, I think ask for your name, email, and things as such. And then it gets sent to us. It gets sent to my co-coordinator because she's handling Project Y Code. And then we'll go ahead and connect with you. And then we provide information of all the steps you need to take to get certified, which again is overall, it's just an 8-hour training. You have to pass a certain test at the end with, I believe, an 80% or so. And then we help you with figuring out the next step. You do have to also be inform you of this. You do have to get background checked, which is just a live scan. You just go in, they do your fingerprints, and then if you're good, then you get to go. So the overall process could take between 3 to 4 weeks. Mine didn't take that long. I don't know if at the time there was not many people getting certified, but just an FYI, it could take that long. But yeah, we definitely could still help enrolling over the phone, like I said, and such. So please reach out to me if you have any questions via email.
That was really helpful. Thank you.
And you can actually enroll people year round because Medi-cal doesn't have a deadline to enroll. And there's certain life events that allow you to enroll into health insurance through Covered California. So if you get married, you have a baby, whatever, these people still need help to enroll into some type of health insurance. So there's really no deadline for that. And when I was getting people certified, and I was certified myself as well, it took 3 months sometimes to get someone their badge. So I am very happy to hear that it's not like that long anymore. Yeah, Soham, do you remember? Oh my God, it was so bad.
I think my badge took 3 months or 2 or 3 months. Like it took so long.
Yeah.
Also, the training, just want to add in there, it it does take a while, but you have a deadline to finish it by. Don't do it in one day. Don't ask how I know. It's not fun. But it is a pretty easy training process, and the PowerPoints that they give you to learn are very they're good. They're good PowerPoints, and it's a good training material. So.
And then I think I'll just answer the last question from John really quickly. If I would suggest a postbac is more beneficial compared to either a master's or a PhD program, it depends what you want to do with it, right? So I always knew that I got exposed to public health in the concept of public health in college. And as soon as I was exposed to it, I'm like, this is something I have to be involved with. It's, what's been missing from medicine from my life. And I need to know more about this. So I always knew that I wanted to get a public health degree, master's degree, and then it just so happens that I had the funding for it. So that was kind of really very lucky. A lot of people would suggest that you really think about what you want to do with that degree, because medical schools would rather see you have a high GPA with a postbac program, because those are going to be upper division science classes, than a master's degree in public health. Even though it does show that you're interested in healthcare and everything, it's that undergrad GPA that carries a lot of weight, and the postbac helps counteract that if you had a low GPA from undergrad. A PhD program, if you really want to go to, into the PhD route and then go to medical school, maybe think about like MD PhD programs instead. And you might want to do maybe some research for a year and then apply to MD PhD programs. So I think it depends why you're getting this extra degree. And if it is, because in my case, I was going to get it anyway. And my funding actually would go away if I didn't use it within 2 years. So I'm like, oh, might as well do it. And I still had to take organic chemistry. It was a mess. So it just worked out that way. But if you want to get to medical school, I suggest doing a postbac program, either a formal one, like through the UC Consortium. I know that Mi Mentor has had some sessions talking about it, or an informal one, which means that you just take classes at UCLA or UCLA Extension, or UC Berkeley has an extension too. The Cal States have, they allow you to take classes there. So you can go ahead and do that as well.
Just to add to that, if you're considering a DIY postback, there's on Mi Mentor, there has been so many posts about like different UCLA extension classes to take. So if you're like, I don't know which one to start with, you can definitely just type in UCLA extension and you'll see a lot of posts related to that.
And make sure that you get a high GPA in the postback, because this is like your second shot, right? So you don't want to get a second shot and then mess it up again. At least that's how I approached it. And that's why I said that it was like putting all my eggs in one basket. I was like, I am going all in. I am not doing anything other than studying, even though it hurts me financially and, like to my core, I am terrified of what it means if I don't get into medical school or whatever it is. But you have to go all in and show that you can. And part of that is being strategic about what classes you take. Maybe you don't want to take quantum physics. Maybe you want to take intro to physics, or whatever else it is. So yeah, you definitely want to get as much advice from students that have taken those classes. Maybe there's one professor who prides himself on failing 50% of the class, and maybe there's another one who actually wants people to learn and pass. So unfortunately, you only get that information by reaching out to people. So it'd be great to look at the Mi Mentor sessions talking about the postbac programs. And then also, if you are on Mi Mentor, you can look at the institutions that people are affiliated with, and you can reach out and say, hey, I noticed that you are at the UC Irvine postbac program. I'm thinking about applying or whatever. And one thing I want to note is if you email someone and they don't email you back, follow up at least once, because I can't tell you how many times I leave an email unread and I'm like, yeah, I'll respond to it later. And then I don't respond to it because I just forgot. And all of a sudden I have 200 new emails. So always just respond once or twice, and that's perfectly fine. So advocate for yourself.
Thank you so much, Angelica. And yeah, I appreciate you emphasizing, definitely use Mi Mentor as your resource. I've connected with so many individuals on there, and just like, hey, you did this program or you did this class. And it just helps to get perspective from somebody who sat in there and they know how it goes. So but yeah, thank you both thank you so much to both our speakers taking the time. I knew that you had my back with this event because we stick together, and so we are getting close to the end time of our event. We did share our emails. Please feel free to reach out to us. We'll get back to you as soon as we can. But Angelica is very busy. Please be mindful, like she said, if you need to follow up with her. But she's going to be sitting for her step. So, but I'm sure she'll still be very open to answering our questions. And yeah, so I think with that, we will go ahead and close the event. Thank you so much to all of our attendees and our speakers.
Thank you.